Hi, I'm Dr. Ben Graham's Chiropractor Rehab. And what if I told you that you have a sixth sense? And that this sixth sense is very well the greatest determining factor on whether you're going to be a person who's dealing with pain all the time or not. Do I have your interest? Well, if I do, stick with me, because first I'm going to prove to you that you, in fact, have a sixth sense. Then I'll explain how it works, why it's critical to having a pain-free and healthy life, and fourth, probably most important, if you've lost it, how to get it back. Thanks for sticking with me. So first, I need to prove to you that you have a sixth sense. Let me ask you this. What are your five senses? Sight, smell, taste, hearing, and touch. So to prove that you have this sense, I'm going to ask you to do something kind of silly. First, you're going to close your eyes. I'm going to have you hold up one finger. I'll tell you which one once we're there. And then I'm going to have you open your eyes. And if you have the correct finger up, I have proven that you have a sixth sense. So let's do this. So close your eyes. Now hold up your index finger or your pointer finger. Hold it up. Okay, now open your eyes. Are you holding up this finger? If you've done that, congratulations. You have a sixth sense. It's called body sense. Okay, it's not part of your five primary senses. It's an extra sense. And this is how it works. It's really interesting. I found that not a lot of people actually know how this part of the nervous system functions. So come in here with me. So you have a specialized part of your nervous system that detects the movement and alignment of your joints. And these nerves tell your brain how your joints are moving. Your brain processes that information and then sends signals back down your spinal cord into your muscles, controlling your muscles. Your muscles in turn move your joints. Your joints move, sending signals to your brain, and that goes back into your muscles, joints, brain, muscles, joints, and that's the cycle of how you move from point A to point B, or you lift and pick things up. It's this constant feedback loop that occurs. Now, this is where this study comes in. And the study was published in the Journal of Manipulative and Physiological Therapeutics. And it's really quite interesting what they did. So they had two groups of people. One group had history of subclinical neck pain, which means they had some neck pain episodes, but they really weren't that bad, like to get them into a clinic. So subclinical neck pain. That's group one. Then they had another group who had no history of neck pain. And then what they did was that they used some technology and they had them put their elbow in 4 different positions. And really what they were doing is determining how accurate they were with those positions. Or what they're challenging is the ability of their brain to understand where their joints and muscles are. And by the way, I should tell you this whole sixth sense is called proprioception. Okay. That is your new word of the day right there. So let's dive into the study. We're going to get right into the key findings here. So what they found was that these results suggest that asymptomatic people who have a history of subclinical neck pain have reduced elbow joint position sense accuracy compared to those without any history of neck complaints. So what does that mean? It means that the group who had history of neck problems had less accuracy or were less aware of where their elbow was compared to the group that didn't have any history of neck problems. So why would this be? Why would a neck issue disrupt your elbow accuracy? And why does it even matter? Okay, come on in. So imagine this. When you have a injury, let's say to your muscles, the muscles are injured and then they get inflamed, that causes pain. Now, in response to that pain, your muscles tighten. They also go weak, which then takes your joints and makes them become dysfunctional. That basically means they just don't move as well as they should. Now, when your joints don't move well, this nerve signaling gets disrupted. And if the brain isn't getting good input, it has bad output, which then makes even more issues with your muscles. We call it muscle impairment, which then leads to more joint dysfunction, more lack of good input into the brain, and more muscle problems, and that cycle begins to build on itself. We call that the vicious cycle. Now, what they're saying is that even though pain goes away, this cycle can persist. Let me show you. Look at this. There's evidence in the literature to suggest that muscle impairment occurs early in the history of onset of neck complaints. So when your neck's in pain, muscle impairment sets on very early. It's almost immediate. I mean, it's like spontaneous. Now, this muscle impairment does not automatically resolve when neck pain symptoms improve. This is huge. And this is what I run into time and time again in the clinic, is that a person very rarely comes in to me and it's like, Doc, I've never had back or neck problems, and now suddenly I had such a bad episode, I need help. That never happens. It's more like, well, it shows up, but then it mostly goes away. If I ice it, I rest it, it goes away, but this episode's just not going away. Well, why is that? And the reason is that although the pain is going away, the inflammation's burning out, the underlying muscle imbalance and joint dysfunction is still there. The proprioception is reduced, which is driving this vicious cycle. And that's why they say in this study, deficits in proprioception and motor control, that's just another way to say muscle control. So deficits in this sixth sense and muscle control, rather than pain itself, may be the main factors defining the clinical picture and chronicity of different long-term pain complaints. In layman's terms, they're saying that the lack of good joint sense or body awareness where you are, in combination with muscle impairment, may be the true defining factor in whether or not a person's pain episode turns into chronic pain. Okay, you have a sixth sense. That's how it works. That's why it's important. But how do you get it back once it's gone? Let's move to the next part of the study. What they found, and this is what they did, is that they used spinal manipulation or chiropractic adjustments delivered to the dysfunctional neck or cervical segments in people with subclinical neck pain, improved their joint position accuracy. So let's rewind. What does that mean? It means that these people went to a chiropractor, they had their neck adjusted, okay? That turns on the joints, makes the joints fire better signals to the brain controls the muscle better, and that cycle starts to reinitiate, and what happens? That proprioception, that sixth sense, turns back on. And now they function better, which is, I'm just going to read this verbatim because I don't think I could have said this better myself here. The take-home points. When joints do not move properly due to injury or lack of mobility from disuse, that's like not moving them enough. The receptors in the associated joints, tendons, ligaments, and muscles do not fire properly and do not send sufficient information to the brain that is required for proper body awareness and coordination motor control. Chiropractic adjustments restore mobility, restore sensory input into the brain, and restore neuromuscular function and coordination. Chiropractic adjustments don't just alleviate pain, they alleviate the underlying dysfunction leading to pain, which is huge. Let's reread that. They alleviate the underlying dysfunction leading to pain, and thus restore not just comfort, but function and quality of life. That's huge. And so, and that's, as a chiropractor, that's what all chiropractors do. That's what we do here. The adjustment is a critical element in how we get people well, but we also combine other things as well. We use deep tissue massage when muscles have gone too tight, and specific therapeutic exercises. We use technology like spinal decompression. We're the only clinic in the area that uses the DRX 9000. We use low-level laser, ultrasound, electric stim, but really we have all these components, but then we work with you to determine what combination is going to get you to not just feel better, but function better. Now, if you're wondering if I'm just blowing smoke or if this way might actually work for you, look, no worries. We have what I call our good care promise, and it's really simple. If we don't see measurable improvement by your first re-exam, which is usually 3 to 4 weeks in. By measurable improvement, I mean like you're feeling better and we can measure the changes. If we don't see that by the time of your first re-exam, we're done. Like we don't continue on, we can talk about next steps. So if you're dealing with issues and maybe you're interested to see if we can help, just call or click right now. We'd be happy to get you in and we can sit down and talk about whether or not we can actually help. I hope this was at least informational to you and you got some value from it.